Great. So can everybody see my screen? All
Not
right.
yet.
Okay. So I'm going to have to share again, I take it, Renee, correct?
Yes.
Okay. Share that screen again. All right. There we go.
Perfect.
Okay. So my name is Denise Sawan Caruso, and I am actually a licensed speech and language pathologist in the state of Ohio. I am in my 45th year of practice. And I am currently now a regional coach, as you can see on the screen, with the Ohio Center for Autism or Low Incidence. And so when we talked about doing communication, of course, it's a big thing. I mean, behavior is communication, and we all know how powerful that can be. And so I thought, well, what would I really want to focus on? And I thought, I'm going to pick my five favorite communication strategies that I probably do and recommend in trainings, in consults, and observations, and in discussion. So the thing about communication is this is about how you communicate with individuals with communication issues. So it can be a broad base. It can be with our individuals with autism, Down syndrome, mental health. I use a lot of the strategies I talk about with my own nieces and nephews when they were small, and continue to use with my great nieces and nephews as they are now having children. And I find that the strategies are really, really powerful. So I'm just going to highlight 5 that I think are most important. The first is using the what to do words. And so a lot of times what we do is we're always trying to use words like stop and no, or words that sort of turn children off, or we're always telling them not to do something. But if they knew what to do, children and adults, then they probably would be able to naturally be able to do it. So if we're going to use words like no and stop, then follow it up with the what to do, not the not what to do. And so you want to keep your words really concrete and clear, and because when words leave your mouth, they're gone forever. Can't grab them back. And so you want to be sure that you keep those words clean. Sometimes we use, nouns and verbs because they carry more meaning with them. And you want to definitely pair those words with the no and stop, because then you will have a better likelihood that the child or adult can follow through with what you're asking them to do. Again, you're going to want to know your speakers. Some of our individuals have very great communication skills. They have lots of words, they put lots of sentences together, but sometimes you may not be sure if they know the meaning behind those words that come out of their mouth. And as a speech and language therapist, I found it very interesting that particularly individuals with autism, they oftentimes have a lot of words, a lot of expressive language, but they oftentimes don't know a lot of the meaning behind their words. So there's a little bit more of a receptive gap. And again, they're going to do interpretation about what you're doing from nonverbal behaviors, things like, a hand up, a palm up that might indicate wait or stop. But sometimes for some of our children and adults who experience trauma, that sometimes a hand that goes close to them can be also interpreted as being dangerous. So if you're going to be using any kinds of nonverbal behaviors, you're going to want to pair language with it so that the individual understands completely what that means. This is Michael's very favorite strategy, and it is wait time. And I've had to learn to wait, and it probably is the most powerful strategy that you can use. And so I typically, when I ask a question, or I give a direction, or I give an instruction, I wait at least 10 seconds, because what happens when you have a communication issue is you hear those words going in, you have to process exactly what those words mean, and then you have to come out with a response. And what we primarily do is when we're communicating with children and adults, we say things over and over and over and over and over again. So we keep stacking up words, stacking up language. How do I know if the person is able to interpret exactly what those words mean? So wait time gives just enough. I find 10 seconds is a pretty good rule. Just enough to see if that individual is going to respond in one way or another. Now, I've had individuals that I've had to wait sometimes as long as 30 seconds. But it gives me a better idea of, how long do I have to actually give them to respond back to me. So sometimes that little informal assessment of waiting can really be helpful. The third is reducing your question asking. And the reason it's so important is because individuals with communication issues often have trouble with WH questions. So they don't know that a who requires a person answer, a what is item, object, animal, a where is time, a where is place, and a when is time. And so they may not have the ability to understand the WH word paired with the right response. And the second is yes, no questions. And this I always find to be very interesting. If I'm going to present a yes, no question, and the person responds no, then I have to respect a no response. So if I'm asking you to do something and I'm saying, do you want to do it? Or are you ready to go to the bathroom? Or would you like to eat? Or whatever. And they say no, then I have to not expect to have them follow through with my response. It seems really simple, but when you think about it, when you say no, it means no. So now you have to wait and you have to go back in, and then you're going to have to then reorganize your thoughts about how you're going to express it. So so the yes, no is one issue and the WH questions is the other. And so that bombardment of WH over and over and over again can be frustrating. So we want to be careful, and we want to use a lot of those what to do words. So it's time to go to the bathroom, or we're having something for dinner, or this is what your job is, et cetera, et cetera. So you also, if you think about decreasing question asking, that's when you go into the commenting, describing, or the modeling. So it replaces question asking. It gives no question in the person's mind of what the expectation is. And it gives you verbal information about what's happening. And one nice thing about it is it builds up the receptive language in individuals with communication issues. You're not placing a demand on them with answering a question. You're building up by giving them information. You can do it with young children during play. You can do it when you're describing emotions, a facial expression. You can do it when you're explaining what a person can do at a job or in the community. You can actually use commenting, describing for anything and everything. The environment, others' actions, surrounding, watching other people in the environment. You can talk about what they're doing. You can talk about what the person is doing. I found years ago when I had just started out as a speech and language therapist, I had hours and hours and hours. I had video done on my communication with others, children, adults. And what I found is I had to monitor, reorganize my communication. And through practice, I learned I did about 80% commenting, describing, modeling, and about 20% question asking. And think about this. If I'm participating in something and I'm hearing somebody talk about it, I hear the words and I'm doing it, then that gives me two good modalities that really can support my clear understanding. And so I found that it was extremely important for me to modify how I was communicating. And then the last I can't say enough about, which is the use of visual supports. Not all of us, but most of us are visual learners. And we know that individuals with disability oftentimes have a primary visual support system versus an auditory support system. And so we definitely want to pair visual supports with the words that we're saying. And it can do everything. It can support the transitions, which can tend to be really, really difficult. About routines, work routines or school routines or home routines. It really helps give us information on directions and instructions. It can help us with answering questions. It can give us choice, and choice making is such a language empowerment opportunity. And I look at it this way: if I give a person a choice, you want to do this or this, or this is available and this is available, choose one. You actually have created the scenario, but you're giving them a choice. And when they make a choice, it empowers their communication. So it allows an individual to have some control over things that they can do in their environment. And adding that visual support makes it really clear about what it is the choice is about. It helps with accessibility. Those of you who work in schools with curriculum and standards. For those of you who work at home or with jobs, it really provides them with a concrete way to look at what they're expected to do. So visual supports can support everything. And we can look at visual supports from a very basic of using objects. We can use photos. We can use picture icons. And if you have readers, you can use written word. So it's anything that happens to be visual paired with your language. So those are the 5 most important areas of communication tips that we can do as individuals communicating with others with communication issues. I put a little resource there for you. You can search our ocali.org website for more information on supportive communications, social skills, and visual supports. And also for visual supports, we have what we call our grab and go resource gallery. And in there are many, many, many examples of visual supports that you can download and use, as well as blank templates that you can download and use and put your own information in. We also include in some of our grab and go some videos that shows you how to use visual supports and how to put them together and how to create them. So that is my 5 communication tips.
Excellent. Thanks, Denise. And I put that link in the chat. I know I've shared that link and resource many times, but there's just some great interventions and strategies in there that are, at your fingertips. So for folks who haven't checked it out, definitely encourage you to do that and make sure you save or bookmark that. And so what questions are there for Denise? Any questions or comments?